CK is 10-year-old Hawaiian male at clinic for persistent asthma, November 14th, 11 a.m. History of present illness. Asthma of moderate severity. He had difficulty breathing since 2005, mainly at night, but in the past week it occurred every day. Cough with white mucus seemed to be associated with his asthma. Chest congestion with wheezing and SOB. Past medical history. He has knee pain bilaterally. For family history, his father has asthma, his grandfather has lung cancer. Social history, he lives in Hawaiian beaches, lived with both parents, one older sister, one younger brother. He is fourth grade at elementary school. He drinks soda 3 cans every day. Physical activity 8 hours per day for basketball, playing basketball on the team. Sleep well for minimum of 8.5 hours every night. And his father smokes. For immunization history, he takes flu shot every year at school for review of system. He has persistent difficulty breathing every day for past week. He has tight feeling in his chest couple times a day with congestion and wheezing. He has SOB. He has chest hurts when he coughs. He's born with kidney and leg problems. For vital, height is 4'2", weight 93 pounds, blood pressure 110/75, heart rate 92, which is a little high, respiratory rate 18, IBW 28 kg, BMI 26.15, overweight, BEE is 1225.9 kilocalories per day, creatinine clearance is 119.7. Lab results taken on June 2011. All the value looks normal. A lipid panel was not taken. For observation, patient had difficulty breathing when he came into the clinic, but after they put him on the nebulizer, his breathing improved. Patient is overnourished with no hearing or vision limitation. There is no allergy was found for this patient. For his medication, for asthma, he's taking Palmicord, generic is budesonide, 0.25 gram per 2 ml. Inhale 0.25 milligram PO, TID PON. Patient was non-compliant when he said he don't take it when his symptom is not bad. And he also take Polar albuterol sulfate 90 microgram inhale 2 puff PO Q4 to 6 hours as a backup for fast relief of the symptoms. For cough, he take guaifenesin DM, OTC. For pain meds, he take acetaminophen. He doesn't take any of the dietary supplements or other products. For etiology, for risk factor for asthma, listed in NAEPP is family history, environmental exposure, viral respiratory infections, tobacco smoke, air pollution, diet, low intake of antioxidants and omega-3 fatty acid, recurrent wheezing. For this patient, he has family history with his father, environmental exposure, father smokes tobacco cigarette, recurrent wheezing. Fleming risk score was not calculated because there was no questionable information. For assessment, patient does need a treatment because he is currently suffering from difficulty breathing, SOB, chest congestion, coughing, and wheezing daily. Treatment could improve his quality of life by helping to prevent recurrent exacerbation of asthma, minimize the need of clinic visits, and prevent long-term loss of lung function. Evaluating the medication, starting with Palmicord. It is an inhaled corticosteroid (ICS). It is preferred therapy for long-term control therapy in children of all ages, according to NAEPP. The current dose of 0.25/2 is not appropriate because the recommended dose for children aged 5 to 11 should be 0.5 to 1 daily. Route of administration is appropriate, specifically targeting the lungs. Interval frequency 3 times PRN is not actually appropriate. Um, for this drug, dosage should be either once daily or twice a day, and there's no side effects was found for this medication. The second medication is albuterol, which is a short-acting beta-2 agonist. It is most effective bronchodilator and are recommended quick relief therapy for all patients with asthma symptoms as needed basis, so it is appropriate. Frequency and route of administration is also appropriate. For alternatives, for long-term control, starting with long-acting beta-2 agonist, LABA, most recommended for use in children aged 5 to 11 years old in combination with low-dose ICS, so appropriate. There is leukotriene receptor antagonist, also recommended for conjunctive therapy with low-dose ICS, but not as effective as LABA. There is mesalazine, which is a SR theophylline, can be used as mild moderate bronchodilator as an adjunctive therapy to ICS. However, theophylline has a drug interaction with albuterol, so it's not appropriate. There is a cromolyn sodium and nedecromil, not preferred for this patient because they are used for treating only mild persistent asthma. And there's immunomodulator, not for this patient, used as an adjunctive therapy with high dose ICS, LABA for patient with allergy and severe persistent asthma. For short-term control, there's alternative for anticholinergic, can be used as an alternative to patients who cannot tolerate SABA. So it's not appropriate because this patient can use SABA. There is no medication with no therapeutic indication, and there's no interaction between patient current regimen. For recommendation, continue to take Pulmicort, but increase the dose to 0.5 mg/2 ml and take this med once daily. Then continue to take Proair. And also, if the symptom still persists, we can think about the adjunctive therapy such as LABA along with ICS the next visit. We will make asthma action plan for students school. It is summarized for things to monitor, what to do for emergency case, and to make sure patient is compliant with meds. Medication reconciliation, there's none. Drug to avoid this patient. Drug that cause or worsen the condition is aspirin, NSAIDs, benzalkonium chloride, non-selective beta blocker. Drug that interfere with current medication is barbiturate, carbamazepine, phenytoin, quinolone, lymphoprene, 3IP3A4 inhibitor, anticoagulant, beta blocker, MAO inhibitor, sympathamimetic, TCA, theophylline digoxin diuretics. Recommended tests includes lipid profile, and also possibly we can do pulmonary function test and chest X-ray. Goals of therapy: to maintain a long-term control of asthma with the least amount of medication and hence minimal risk of adverse effects. Monitoring parameter: continue to assess the condition on ongoing basis every 1 to 6 months. Patient's asthma should be well controlled for at least 3 months before stepping down therapy, and also identify allergen exposure that may worsen the patient's asthma, and also height is monitoring parameter because of ICS. Drug side effects includes abdominal pain for Pulmicort, abdominal pain, diarrhea, vomiting, coughing, respiratory tract infection, conjunctivitis, ear infection, suppression of growth, albuterol sulfate, palpitation, tachycardia, dizziness, headache, nervousness, tremor, sleepless, weakness. Patient education. We are going to instruct you how to use the Pulmicort one more time. Use it with a jet nebulizer. Place 2 ml of the liquid into the medication chamber of the nebulizer. Attach the mouthpiece or face mask to the drug chamber. Then attach the drug chamber to the compressor. Sit upright and place the mouse blade into a mouth, or cover your nose and mouth with the face mask. Breathe slowly and evenly until you have inhaled all of this medication. Usually it takes 5 to 15 minutes. Inhale one dose once daily. This med should be taken about the same time every day for the optimal delivery. You may notice this drug is working when symptoms are relieved and breathing get easier, but try not to skip a dose. Store upright at the room temperature in a dry place and protect from light. Do not freeze. This medication is corticosteroids, which may cause suppression growth in children. For the ProAir, this is for a backup fast relief of symptoms. Inhale 2 puffs by mouth every 4 to 6 hours as needed for wheezing. Prime the inhaler before using for the first time, or it has not been used more than 2 weeks, by releasing 3 to 4 spray in the air. Wash the mouthpiece for 30 seconds with warm water and dry slowly once a week to ensure proper dosing. Store at room temperature, protect from light. Do not take more than recommended. Do not take more than recommended. And then please report to the doctor if the effectiveness is not enough, or any serious side effects occur. For the diet lifestyle change, after finding out what type of allergen has caused the condition worse in the past, I will recommend to avoid those exposure which contribute to asthma. And treating the condition is team effort, come from the family. So we will instruct the father to smoke away from the children, and also counsel for the smoking cessation since his father has lung cancer. Physical activity at play or in organized sports is an essential part of the children's life. We encourage full participation in physical activities. And try to eat more healthy foods, vegetable, white meat, drink plenty of water, etc. And we recommend you to take the asthma action plan, which we have it right here. Basically, this is for one copy for you and one copy for your school's teacher and the nurse. So it has a list of the stuff that you need to you need to care about, what causes asthma, and when you take the medication, and you check the record of it, you keep the record of it, and that's going to help you to be compliant with the medication as well. So if you need more information, please go to lungusa.org, visiting American Lung Association for more information. Thank you.